It's like with anything, people in an office can have an idea and say, oh, this is how it should be done. I don't think that works. I think you need ordinary people. I think you need people who are working in normal situations because they know what works. I think a project like this ideally would improve services for the future and try and make more people's experience a positive one.
In 2014, NHS England Wessex, who commission many NHS services across Dorset, Hampshire, including Portsmouth and Southampton, and the Isle of Wight, approached the local health watchers in their area to start a project to really improve the way that patients are involved in commissioning. Together, these organisations wanted to give interested local people the right skills and knowledge so that they can get involved in designing services. Many people were interested from across the region in how they could get involved in improving the services that they use.
At Healthwatch, we hear from people all the time that had experiences of using the NHS and social care system but are unsure how to really make their voice heard. So this project was a unique opportunity to bring together all the different parts of patient engagement to really try to improve the way that things are commissioned across a very large area.
The reason we wanted to work with Healthwatch was because it became quite clear to us that Healthwatch was a representative of local patient groups, and patients work very closely with Healthwatch to provide feedback on services. We wanted to work more closely with Healthwatch in order to work more closely with patients.
We decided that actually it'd be really useful to do a kind of set period of training with people from across the Wessex area about how they could get involved in health services and how they could make sure that the communities had a voice within that. So the training sessions were about getting them to really understand how the system works, particularly within commissioning, and the places at which they could have some input.
Because of these training sessions and what I've learned and the experience I've gained, I feel much more confident that I can take part in future and be more useful. I think what I've learned with regard to these services, they try to serve the individual needs as rather you're just a number or just a block. Things are changing so rapidly, and you can never learn too much, can you?
I think engaging with service users and the public is hugely important. To get things right for our population, we need to understand what their experience is of the services that we're trying to buy. So we might think we've commissioned an absolutely fantastic pathway, it makes huge clinical sense, but if people don't like it, if they can't access it or they find it difficult, then actually we haven't succeeded at all.
The local health watchers also produced a toolkit for commissioners to use when making decisions about services, to make sure that engaging local people is vital in how services are designed.
We've developed this toolkit for us to use locally, but we're hopeful that it will be a toolkit that can be used by commissioners around the country and other Healthwatch organisations as well, to really get to grips with some of those difficult discussions about services and commissioning.
The toolkit's really fantastic because it's a resource that can be used by all sorts of different people. Because it's clear and simple to follow, it really means that everybody knows where everybody is, and we are able to use a common language to describe what we're trying to do.
We really believe that this toolkit will be a brilliant tool for commissioners to use in the future, and are excited by the potential this project has found to make a difference across our services.
Well, the partnership between the Wessex Healthwatches and NHS England is unique, and it's been an amazing opportunity to gather the wider opinion of the public. To test out the work that we've been doing within the project, we carried out 2 pieces of work specifically around CAMS and maternity, and this built on some of the work that we'd already done within the Healthwatches regions. So we really hope that this will carry forward to improve the development and commissioning of services throughout the Wessex region.
We're really excited about the possibility of this project and where it can go. Never before have the Healthwatches and NHS England across this large an area come together to really make sure that people that are using services can get their voice heard, and that commissioned services really do reflect what people want.
And looking to the future, it's our aspiration and our intention to create more opportunities for local people to be involved, to have their say, and to effectively influence the commissioning of local services. And we're going to do that together, because together we're stronger, and together we really can make a difference.
I think a project like this, where you are taking on board what ordinary people think about the services and what they think was good and what they think was bad and what they think could be better, ideally would improve services for the future, so that in the future the service would be better for them, and maybe you can try and, obviously you can't eradicate all the problems, but to lessen the problems and try and make more people's experience a positive one.
For more information about this project, contact your local Healthwatch.